Vigorous Warrior 2026, 38 nations, more than 3,500 participants in the exercise.
I like the Moscow scenarios because of the difficulty, the complexity. So it's always good experience how we would treat several patients together.
Our partners is seeing if they're taking the lessons identified and lessons learned from Ukraine to implement those into their TTPs for their units. And then that's an excellent chance for other nations to see those that have done that and how they've done that differently maybe versus another one. So vitally important right now that we see these things implemented as soon as possible.
Our objective to train together, to learn from each other about the procedures, because some of the procedures are similar, some of the procedures are not similar, and we have to take the best from each civil world and combining our efforts to be ready for saving lives.
In a live exercise, you may have 100 moulage patients. A VR headset can have 1,000 moulage patients. So we can actually enhance and we can grow the exercise with a factor of 100 easily.
Vigorous Warrior!
Full cell protection covers seasonal battle injury, which makes up a vast majority of the reasons why soldiers can't do their job. So if we're able to protect the soldiers and minimize the effect of those kind of outbreaks, diseases on our fighting population, it allows them to do their job as much as possible.
Medical is a critical enabler and is also a critical resource that nations have to step up on. And Vigorous Warrior is an important arena for training such units.
Oh yes, this is amazing, working together with the American team, with their soldiers, sharing experiences, being together, that works a lot. I think it's very important for us to learn how to work each other with other NATO allies, because in certain circumstances we may need to cooperate together, we may need to supplement each other. But I think this is not our shortcoming, this is our strength, that we are different and we can learn a lot from each other. So I think being together, being part of this community makes us a lot stronger and helps us to work together.
evolution of warfare that's going on and our realization that with the introduction of more drones, that we're having to have smaller and smaller footprints to have big punchy capability. From this exercise, I think the discussion groups that we've had, really interesting, lots of teaching, lots of experience. One thing for me that I've noticed is we realised that the medicine that we all interact with from every nation, really high quality.
Why we are here is mainly to understand how our partners operate, and come the time when we need to rely on each other in a time of war, in a time of conflict, understand how they operate and how we can integrate to best effect to make sure we are delivering the quality medical care that happens as a result of conflict.
I think that would vary quite a lot depending on the operation or the mission and the environment that you're in. But I think we're learning to be capable of seeing more casualties each day, getting casualties out as quickly as possible.